increased testing capacity. We're still seeing reports of severe rationing in many cases because of the limited supply. It appears to be close to impossible for average Americans to get tested without being hospitalized first. So when can the American people expect to see these test kits available at doctors' offices, at urgent care, at minute clinics, that sort of thing, specifically when?
Well, I'm going to have the Secretary step forward and address that. But let me say we've made great progress over the last week. 1 million tests are in the field. Every state lab in America can do coronavirus tests. If you're concerned that you have coronavirus, your doctor can contact the state lab, can have a test processed. By the end of this week, another 4 million tests will be distributed. But to your very important question, we're working day by day with the largest commercial labs in America. We had some good discussions today with outside experts as well, who said that when the president brought the commercial labs in, he did exactly the right thing, because it's those big companies that have logistics infrastructure all over the country, have labs all over the country, that can distribute the tests, process the tests, whether it's Quest or whether it's LabCorp. And we believe that in the days and weeks ahead, we're going to continue to see the availability of tests dramatically rise, and we're driving toward that every day. Mr. Secretary, did you want to add to that?
Sure, maybe Dr. Redfield can add in also. So by the end of this weekend, we had 1.1 million tests that were actually shipped. We have another 1 million that are either in transit or waiting for orders. So we actually have a surplus capacity already of tests that have been produced. And as the Vice President said, by the end of this week, be another 4 million tests. So the tests are out there. The tests are in every public health lab in the country. They're in hospitals. They're in labs. But I think there's a false premise in your question, which is the notion that just because I as a person say, oh, I'd like to be tested for the novel coronavirus, I should be going to a minute clinic or some other facility and just walking in saying, give me my test, please. That's not how diagnostic testing works in the United States, or frankly almost anywhere in the world.
Trump said on Friday, said anyone who wants to get tested can get tested.
If their doctor, we've always been clear, if their doctor or public health physician believes they should be tested, it needs to always be clinically indicated to receive a test. So it's a false premise. Go to your doctor if you first. Actually, don't go to your doctor. Call your doctor's office if you believe you may have the novel coronavirus. Call the clinic, call the hospital, call the doctor's office, so that you don't just walk right in, follow their infection control procedures for doing that, and then they will decide, working with you, whether a test is appropriate to be done. But there are millions of tests out there now, and it's going to, as the Vice President said, with Quest and LabCorp getting it at the doctor's office, swabbing their distribution and transport system, it's going to be an even better, closer to the patient experience, as I talked to you on Saturday when we met together.
That's very good. And Answer, I'm going to ask Dr. Birx to speak to this too, because she's just done a tremendous job bringing our commercial labs to bear on this. But to your other point, the president directed us to essentially change the criteria that CDC was giving labs around the country. We heard from governors around the country that people that were only mildly symptomatic were being told that they couldn't be tested. We changed that. We changed that description. And so, as the president said, anyone who, on a doctor's order, wants to be tested can, at a doctor's indication, be tested now. We're working to fill that need, and we're making great progress every single day. But I wanted Dr. Birx to speak to it as well.
Yeah, I just wanted to talk to you briefly about what happened in decreasing barriers. I've been a lab person, I've been a vaccine developer, I've been a doctor, I've been all those things, but I've never in my lifetime of government service have worked with the CDC in a way that every time the state or local government calls and says, I have this barrier, I need a modification to the regulations. That has happened almost daily. And the reason we have commercial labs willing to step in immediately is because the FDA has created that ability and posted on their website, I don't know if you've been there, this unbelievable waiver system and the clear definitions where every single hospital, every single university can utilize this testing algorithm. And that's highly unusual, but it's also what's bringing the super large high throughput companies to the table. And I just this has been unique for me to be able to see this unbelievable dialogue between what states need, what local governments need, and federal government being responsive with changing those regulations. And that has been really wonderful to watch.
Thank you, Dr. Burke. Can I get you right here?
Yes, I wanted to ask